As you can see by the title down below, I just want to share with you an opinion about the use of herbal eye medicines versus the medicated eye drops. So, being of an African origin, yeah, herbal medicine is part of our culture and part of our upbringing. So at least most of the Africans at a certain level of life must have ever used these traditional eye medications or any form of herbal medication. Only that there are a number of challenges or a number of effects that come with herbal or traditional medication because of the way they are prepared, and that actually causes a lot of havoc because some of this medication is actually prepared under unhygienic conditions, which makes it a risk of carrying uh, bacterial infections and transferring them directly to the eye. Traditionally, we have a number of medicines that actually are used to treat eyes in our different societies and cultures. This vary actually according to culture. But what is traditional eye medication? First of all, uh, the traditional medicines are just medicines that are used by different cultures basing on beliefs. Yeah, basing on beliefs because most of them don't have any scientific proof that they do offer what they are actually claimed to offer or to treat. So some of them are basically beliefs that are just passed on from generation to generation because you've grown up seeing the elder people in your culture using these medications. So you also just in one way or another just adapt and start using them. Yeah, basing on the experiences and the beliefs that they have told you about those medications. But the threat that comes with using traditional eye medication is that uh, they they are unsanitized. Yeah, the unsanitary aspect of it, and then the possibility of carrying bacteria along, and this could actually impose a threat to the eye. If you put it in the eye, this can actually uh, probably cause an infection in the eye, which is not a good thing. So a lot of caution should be taken when you're using traditional eye medication. And then the other thing that you should bear in your mind is that uh, if you're using this eye medication, you should know that they come along with some harmful or harmful effects or dangers. So because of that, you should use them knowing that they can pose you a risk of even going blind, because these traditional eye medications, some of them are acidic, some of them are alkaline, and you know both acidic and alkaline substances in these eye medications can easily cause some level of inflammation in your eye, which can also maybe even result to a keratitis or a wound on the cornea. So, and also these leads or the herbs that they use, yeah, they tend to suffer from their own diseases like fungal infections on the leaves, and then fungal infections on the leaf, and then using them, it's like you're directly transferring the fungal infection direct from the herb that you've got into your eye. Yeah, and if you've ever suffered from a fungal corneal ulcer, it's one of the difficult corneal ulcers to manage. So you don't want to reach that, because if they are not managed early, you can end up with an endophthalmitis and even end up with an evisceration of the eye. That's the removal of the eye. So if you're the unlucky one, after using this herbal medication, you can actually end up with those complications, which is not good for anybody. It's not worth it. Yeah, it's not worth it. It's not worth trying your eye on herbal medications, because actually what drives most of the people to use these medications is because these are really very cheap and affordable and accessible in the society, and they come along with a lot of promises that actually uh, these medicines don't deliver. So if you don't think about it and internalize about it, you can find yourself falling culprit of this. So we need to be careful. So I just want to take you bit by bit on these traditional eye medications that are commonly used in the society. Most societies, uh, you find the use of urine. It's not only in my country, but also other countries. Yeah, there is use of urine for treating eye diseases. Yeah, but actually, when you look at this, uh, is urine actually okay? Sorry, just have my son there. You pass their side. You can pass there and go and play. Okay. So I have a toddler here. Okay, bye. So you find people using urine to treat very many eye conditions, but is it really worthy to put urine in your eye when you look at it? Yeah. So when you look at urine, urine is one of the waste products that the body excretes. Yeah, it's a waste product from the body. A waste product is simply a material or a substance that is discarded as useless. So you push it out because you no longer need it. So now after the body pushing out the urine, meaning it's no longer of use in a human body. So in any circumstance, why would somebody think of putting back a waste substance back into the body? So you want to think about it. And actually, a number of people who have used urine in the treatment of different eye diseases say that urine burns. And actually, looking at the components in urine has ammonia. Ammonia is a gas that is, ammonia actually has a very strong and also irritating characteristic, I mean. So putting ammonia in your eye is actually going to burn your eye. Yeah, because if you poured, for instance, urine, or even if people consistently urinated in a certain place where there is grass, you will find that grass dries away, meaning it burns. So the same thing, if you put urine in your eye, it's gonna burn your eye. It's going to burn your eye, and it's painful. Yeah. And yeah, people have this tendency, the thought of like, if a medicine burns your eye, it means it is strong, so it is treating the eye, which is not true. That is a lie. Doesn't mean that. Yeah, a medicine burns your eye because there is an irritant inside it. There must be a substance or something that is irritating the eye. Baby, you go to the house. Take for Joseph. Go and tell Esther I'm calling her. Okay, bye. 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 And bye. Good boy. You can go. Bye. So, meaning it has an irritant. So, putting urine in your eye, it's going to irritate your eye and even trigger an inflammation in your eye. You see, our bodies react differently, yeah, to different substances. So some people can even be can get a triggered inflammation in the eye because of applying urine in the eye. And then also, when we look at urine is not clean. It is an unsanitized product because it's a waste from the body. And also, urine can carry along bacteria. It can carry along bacteria, different bacteria that cause different kinds of diseases, including bacteria that cause UTIs, and STIs can be carried along in the urine. So if you already had this infection and then you're putting that urine into your eye, you're introducing infection into your eye. So is it really worth it for you to get your urine and put in your eye? It is not. Yeah, even if it's yours, it's not, because it is unsanitized, it is carrying bacteria, because from various infections that can be in your urinary tract, and you're directly putting that into your eyes. So it's not worthy really putting urine into your eye. A lot of people speak about urine doing wonders, but these are things that people are just speaking from their own point of view. It's not something that is scientifically proven by research that it does that. So using this urine for treatment of your eye diseases, others claim it improves eyesight. Those are all assumptions by different individuals, yeah, because still in the very group of people who claim that urine can treat diseases, some of them also still confess that it can cause blindness if it has disease. So why would you risk your eye? Because first of all, before you put the urine in your eye, you're not going to test it to find out whether it contains anything. And anyway, it's not worth it. I can't imagine holding urine and putting in my eye. Yeah, even if it's my own urine, it's not worth it. So I'm just health educating somebody because I've seen a number of people using urine to treat eye diseases, and even people that I do not really expect to do that. Yeah, but you find they are doing it. So it's a big problem in our society, especially if somebody who is doing it is somebody who is learned and has a lot of people who are following and listening to them. Meaning if he or she gives that advice to the community members, that means we are going to have a lot of problems, because first of all, there are a lot of urinary tract infections among people in the community. So using that, we shall have, if people are doing that, we shall end up with a number of bacterial infections in the eye, which include even gonococcal conjunctivitis, which is a very bad type of a very bad and aggressive type of conjunctivitis. Yeah, so we don't want to get those complications. And then also we get people using a number of herbs, which can actually also burn the eye and cause corneal ulcers instead. Yeah, so when you get your eye burnt and you get a corneal ulcer, which is of fungal type, it's a very devastating type of corneal ulcer, and some of them even come with a superimposed bacterial infection in the eye. So you really find a very bad eye, which can even end up with a pending perforation or an endophthalmitis, which are serious complications following use of herbal medicines. Yeah, I'm emphasizing this because we are having a lot of herbalists that have come in the market, and they make herbal eye drops, and these people are very good in marketing those herbal eye drops. They are promising a lot of healing and improving of eyesight. So because everybody is desperate to have a good sight, nobody wants to be blind. Yeah, especially people who always fall victim here are people who are suffering from chronic eye conditions that may actually be not having any cure, or these people are on rehabilitation for low vision. So they are lied to that they can receive their sight back. Baby, baby, okay, take for Esther. Take, okay, take their side. Bye, bye, okay, okay, you take. So I have a toddler here, and he is not feeling fine. That's why he's all over me. Yeah, so we are going to do this live together. I try to comfort him a bit. So a number of herbal medicines are being used. Yeah, if you've ever come across anybody, or if you've ever had used herbal medicine, what was your experience like? Did you get fine? Did things get worse? Yeah, you can let me know in the comment section down below. Okay, you're giving me a phone. It's okay. Call daddy. Can you help me take this for daddy, baby? Can you take it for daddy? Okay, bye. Go call daddy. Okay, keep quiet. So we have that going on, and really when you look at the statistics of the usage of herbal medicines, it is rising because we are having a number of people who are registered herbalists, and somehow some of them are not regulated. So they do a lot of things behind how do I say it? Behind the authorities that authorize them to make these medicines. We have a number of herbal eye drops that are claimed to treat cataract. Yeah, but is this true? If you had a cataract and then you put a herbal medicine in your eye, can the herbal eye drop remove the cataract? Of course, it's not true, but an ordinary person is lied into believing this. Yeah, and the other thing I think that is actually bringing a lot of deception into the communities is that actually most of these herbal companies they do make supplements. Yeah, and actually these supplements are supposed to boost, yeah, but they don't treat, but in the marketing language, they are not marketed as supplements. They are marketed as uh, treatment. Yeah. So I think that is also another big problem that is increasing the usage of these things, because people are lied to that actually what they are buying or what they are consuming is going to treat, and yet in the actual things these are just supplements in form of vitamins that can help with the retinal repair. Yeah, they can help with the retinal repair, because having known that most of certain nutrients are actually very beneficial for retinal health. So, given the fact that they are important and used in the retina, may not actually automatically guarantee that they are going to heal any retinal problems, if at all you have any. Yeah, because if you're an eye worker, you know that most of the retinal conditions, especially those that come with age, most of them are irreversible. So when we are managing these patients of ours, say patients with macular degeneration, which is age-related, those retinal changes that are age-related, and some retinal changes that are hereditary, like retinitis pigmentosa, which can cause permanent blindness, actually among people of different age groups. Actually, the blindness can set in as early as 20s or even earlier than that, actually. So such a person can easily be lied to that what they are going to receive, the herbal medicine that they are going to receive, is going to treat their condition, which is not true. Okay, so yeah, if you're out there and you're buying these herbal medicines, always take time. Yeah, take time. Do not be afraid to ask the person who is selling to you. Ask them in detail about this medication. Yeah, ask them in detail and avoid these crude herbal medications. Yeah, crude herbal medications, like you're getting your urine and putting in your eye. You're getting leaves of trees, squeezing them and dropping in the eye. Yeah, some people put in the eye red paper. Yeah, that is not right. You don't have to do that. And if you're taking supplements, take them knowing that they are supplements. They are not going to treat your condition. They are either going to prevent or to reduce the progress of the condition, but they are not going to treat, because most of these supplements, they are vitamins which are necessary for the body and for the eye, because they contain a lot of antioxidant properties that are going to deal with the free radicals, yeah, and reduce on the oxidation process in your eyes. So you're going to prolong or to prolong your eyesight, or to retard the progression of any changes, especially those related to age, to old age, actually. So that is that. So what is my major take on this? Yeah, if you're using any herbal medication, I would recommend that you use supplements. Yeah, I do not recommend any herbal medication that is dropped directly into the eye, because you don't know what you're putting in your eye. If there is any herb that can be eaten, you eat it to give you vitamins, to nourish the body. Then from the body, the eye gets the nourishment. I would probably 50-50 believe that. But any eye medication that is traditional, or that is um, herbal, that they claim to put in your eyes so that you heal, I do not recommend it, because I don't believe that they even work. They do not work. These are just things that have no scientific backup, things that actually in a long run may cause more complications, because if they don't harm your eye, probably they are going to make you delay with the condition that you have, and by the time you turn up to go to hospital, it is too late. The condition has gotten worse and complicated, so you will probably lose your eye or lose your sight. So yeah, that is my take on on any herbal medication. Either it comes in form of supplement, it's okay, you can take the supplement, but also visit the hospital to really ascertain the condition in your eye and get medicated eye drops. Yeah, that is the take for me. So if you've been using herbal medications and you have your own opinion about their use, yeah, that is your opinion. But on my side, I think that is what I have to say about herbal medication. I still support medicated eye drops, especially if they are prescribed by a qualified eye professional. Yeah, they are a good way to go. They come in a much more researched form. Yeah, and you can also know whether they are good for you or they are contraindicated in your condition. So they're a bit more safer, not even a bit. Medicated eye drops are more safer than traditional medicines or traditional eye drops. So that is my take on that. So yeah, if you've loved what I've talked to you about, or you've learned something, let me know what you've learned in the comment section. And also feel free and subscribe to my channel, because subscription is free. You're not going to pay any money to subscribe. Subscribe to my channel, turn on your notification, and also remember to give the video a like and share to anybody out there who could be yeah, using herbal medication and they actually don't know that it could be harmful to their eyes. So bye for now, see you in another live stream.